Hey, I wanted to share something with you in case you didn't know, but I'm sure you probably already do. But your brain is like 80% water. So if your brain is 80% water, the other 20% close to is built of fats, then there's something you should probably know about being hydrated. Did you know that if you are 2% dehydrated, it is enough to have a negative impact on your brain? So, what I'm talking about by negative impact is I mean like anxious, tense, depressed, angry. All these different things are from 2% dehydration in your brain. So that's something to consider when somebody says, hey, check out this little kid. He's got ADD, ADHD. How many kids you know drink water all the time? How many kids do you know are more than likely dehydrated? How many kids do you believe potentially misdiagnosed when it comes to ADD, ADHD? And then on top of that, you have these kids with this issue going on. You put them on medication. I know some of the side effects from those medications, they all do. They all have side effects. One of those is you're not hungry. Well, guess what? If you're not hungry, you're probably not thirsty either, which is going to make that situation even worse. You see how this works? It's one of these cycles. I take this pill for this ill, and it turns around and creates a new ill that I probably need a new pill for. Right. So, attention, memory issues, all these different types of things like motor skills, um, physical skills in terms of physical performance, all that stuff comes into play and it's all impacted from being dehydrated. 2%. 2% dehydration. We have all these issues from simply consuming water. So the next time you start to think, or somebody tries to tell you that there's a child that has an ADD issue or whatever, or they tell you as an adult you have this, perhaps it's time to increase your water intake, to increase your hydration. Now there is a way to hydrate, and it's always not just drinking water. So when it comes to doing the hydration piece, there's a couple of things we probably want to do. One, when you're drinking water, if it's reverse osmosis or something like that, spring water, you can always sprinkle a little Celtic sea salt in there, a little pink Himalayan salt, just to help you on a cellular level, help your body absorb that. Okay, so you do have that part. If there's also kids involved, because a lot of times kids don't want to drink water, so what we're dealing with there is for the kids, have them hydrate with fruit. If there's watermelon around, the kind with the seeds in it, black seeds, that kind. Um, have them eat a ton of watermelon, cantaloupe, any other melons are great for hydration. You can have them eat oranges. Um, I wouldn't overdo the juices because that's a whole nother issue we're talking about. But if you're hydrating and you're going about it that way, then that would be a great way to actually hydrate your system. You can even look at coconut water. All the different types of fruit that are extremely watery are great for hydration. That's a great way as a parent to get around the kids who don't want to hydrate. So we keep fruit around our house. So we make sure that little kiddo is steadily popping those blueberries or strawberries or those types of things to help with the hydration. So that's something to consider. A couple different tips there when it comes to your ADD, ADHD, that type of stuff. Also, controlling your blood sugar is a big one when it comes to controlling how your body is dealing with attention and focus issues. Okay, processed food. I think I talked about that in another video, and then artificial colors. I talked about that in another video. So all those things, keep that in mind when it comes to what you're dealing with before you go and jump on a medication to try to relieve some symptoms. Let's look at a potential true cause of the issue at hand.